My name is Claire O'Donovan, and as a junior doctor, I am currently undertaking a service improvement rotation at a tertiary hospital in Western Australia. A quote from my initial service improvement training has really stuck with me, and that is that everyone in healthcare really has two jobs when they come to work every day: to do their work and to improve it. It's from an article, What is Quality Improvement and How Can it Transform Healthcare? It emphasises the point that it's not enough to have just a few people interested in quality improvement. Everybody within a health service has to be involved and willing to work towards constant improvement. Early exposure to this concept is something which is important for all healthcare professionals. So I'd like to tell you a bit about my experience in service improvement so far. My project focused on the Acute Medical Ambulatory Centre, otherwise known as AMAC. This is an innovative concept in WA Health to facilitate early discharge and prevent avoidable medical admissions. I decided to do my project on AMAC, as in doing some pre-project investigation within the hospital. This was identified as an area with the potential for improvement that would be beneficial to both staff and patients. To define it, I held a process mapping session, which was attended by stakeholders: consultants, junior doctors, nursing staff and clerks, where I mapped the patient's journey from the point of referral to AMAC to discharge from the clinic. This meeting showed that the issues centred around the actual referral process and booking the patient for the clinic. I realised that although the clerks revisited the form multiple times, there was no way to track how many times they had to do this before the patient was booked to be seen. It turned out to be an average of 6 times when recorded manually. A waste audit of the clinic revealed that the clerk was physically walking up to the ward every day to collect the referrals and drop off the clinic list for the next day. This was therefore a waste in time of 10 minutes per day, 50 minutes per week, or 43 hours per year. This is a whole week wasted just walking up to the ward. I was then able to move on to the analyse phase, where I posed the question to stakeholders: why do nurses and clerks have to revisit the form multiple times before they can book a patient appointment? The group found that there was 2 major contributing factors: lack of information on the booking form to allow booking of the appointment, and chasing up of investigations, either to see if they had been booked or checking the results. A series of quick wins were acted upon, especially in regards to the clerical work within the clinic. I was able to give access to the clerks to the radiology scheduling system to allow them to view the patient's imaging appointment to facilitate booking them into the ambulatory centre. I created a GP flyer that provided information about AMAC, and I also created a quick reference guide for the doctors actually working in the clinic. But my main solution was in the form of redesigning the AMAC referral form and updating it from a paper-based to an email referral system. The first day that I attempted to implement this, however, it failed. Both I and my stakeholders had dismissed the concern as to what would happen if one of the clerks was sick and the relief person didn't have access to this email account. And this is exactly what happened on the first day. I then had to go back to a solution both I and my stakeholders had previously discounted as it was too complicated to implement. This was the e-referral system, which is used for other clinics throughout WA. And while at first it seemed like this was a disaster, it actually worked in my favour, as it meant in the end I got more buy-in from the clerical and e-referral support staff, which should hopefully ensure the success of my project going forward. So my first piece of advice to you has to be this proverb. If at first you don't succeed, try and try again. I have learned an immense amount during my project, especially about thinking solutions through rather than rushing to put them in place. Communication is also key. There is great power in setting up meetings and going to see someone in person. Stand or sit back and listen to what other people have to say. And if you're speaking to someone on the phone, always get the name of that person and write it down in a safe place, somewhere you can access it easily if you need to contact them again. And when you can, ask for the opinion of others not directly involved in the project. They may see a fatal flaw or give you an excellent tip, one which you or your stakeholders have failed to see or appreciate. It's also important to think about the sustainability of your project after it is finished. Although you're able to micromanage when you're undertaking the project, you need to be able to leave the responsibility with the people that work in that area day to day to carry the project forward.